Hello, this is Bob Cook here, and this is a short presentation on the TA technique called the parent interview. So why do we undertake the parent interview? Firstly, to offer relief to the patient, to highlight the impasses between the parent and child ego state, for the child ego state to understand the internalised parent story, and finally, really, empowerment of the child ego state. So what are the clinical considerations before considering the parent interview? Well, number one is an in-depth script analysis that the therapist, that's the TA therapist, understands the early script decisions, the bottom of the script. They understand the counter injunctions, the drivers, and how the client sees the world, as well as, of course, how the parent of the client sees the world. Also, you've got to have an understanding of the internalised parent and their script as well, and need to be more potent than the internalised parent, so that you don't repeat history. And I think most importantly, that you've worked clinically with the client for at least 6 months, so you've got a good working relationship with them, and of course the child in the client before you do the parent interview. That's most important. So you need to know this client before you start the work with the internalised parent. So what are the stages of the parent interview? Well, the stages are, number one, you set the stage. That's really important. That you tell them it's going to be a role play, that they're going to be role playing their parent. And then once you've set that stage, you of course then have a dialogue with that parent, and talk about things like what was their history, how did they get on with their family, and in some ways you're doing therapy with that person, and especially the child in the parent, which is where you need to get to, the unconscious part of the parent. And you need to do a working alliance with that internalised parent through a relational inquiry, just like you would if you were doing therapy with the different parts of the self. But you do need to connect, and that's the goal really, to connect with the vulnerable part of the internalised parent. And in that process you need to not get caught up in the trap of a parent-to-parent competition for reality, if you like. You'll use empathy and nurturing channel to help the parent tell their story, and always remember that the child's listening on here, so they may be getting a different view internally, in terms of internal narratives and understanding of the parent part of themselves, which perhaps they had not heard before or denied before. And this paves the way for looking at the stuck part between the parent and the child listening on, and for further parent therapy work. So further clinical considerations, well, you've got to make sure that the listening child ego state at the end of the parent interview has the final chance to dialogue with the parent. Otherwise, the child listening on might be quite frustrated, and you need to have some sort of empowerment where there's a completion, so that the child listening on can, to talk to the parent in that psychological dialogue. You need to make sure that the client is an adult when you end the parent interview. They're not stuck in their parent interview, their parent or their child ego state. That's really important, that they're in the here and now. And you need to then do a debrief, talking about further work with their internalised parent. Okay, thank you.